Go. All right, for our next section here, we're going to talk a little bit about Mickey buttons. I'm going to talk mostly in the setting of feeding and venting, how to do that, how to help parents with the feeds they may need, so on and so forth. It's a pretty common thing here in the ER. Most oftenly, people show up needing them replaced, or you have a chronic in here, a kid who's going to need meds in here or needs feeds. We do carry replacement Mickey buttons. They are in the storeroom. There's often a couple hanging around on the ped side, where that should be. If you know a kid is coming and needs a Mick button replaced, I would advise you to go into the notes. It's usually in a GI note or surgery note, and see what kind of Mickey button or feeding tube they have. There's a couple different kinds. This is, when you call downstairs, he's gonna wanna know the diameter and the length. And that's really the most important part, is the diameter and the length of the kid's button. It doesn't so much matter, like Mickey's, they have low profile ones now, and they are the same as like the original Mick buttons. So if parents don't specifically say, or if they do specifically say, oh, it's a low profile, it doesn't matter. As long as they have a Mickey button, the buttons we have here, as long as they have the right diameter and the right length, can be used. It doesn't matter if it was a low profile, now we're putting a regular in, or if it was a regular and we're putting a low profile in. That doesn't matter, okay? So the kits come, the docs can, a lot of parents take care of this at home, so you won't see it, but they come with everything the physician would need to put it in. I'm not gonna really get into that. My one note of this is often we're finding these kits are up here. Parents come in, kids have the Mickey button in place, and they need to give a med, so they need an adapter. People were ripping open these packages to get this piece out. Please don't do that. These are a lot of money. The Mickey button extensions or adapters can be ordered from the storeroom. We generally store a couple over in the ped side in a bucket, okay? And that's this piece. And that's the piece that hooks into the button. Okay. Mickey buttons need the extension to do really anything with them. They don't self-vent very well, really at all. They shouldn't with this out. So you'll need this piece to do venting, or to do feedings, or to give meds most of the time. So this Mickey button would be in the patient's belly, like so. Okay, there's a balloon on the inside that keeps it in place. For purpose, I'm going to take them out so I can show you. There's a line there, and there's a line here. To access a Mickey button, stabilize the button with your fingers, line up the lines, and then follow the directions. So once it's in there, it's locked. I can't get that out. Okay? And it will spin. Kids can move around. These go home with kids. This is what they live with, sometimes 20 hours a day. Okay? If you want to de-access it, same deal. Just spin it around. Okay? And you'll feel it kind of unlock, if you will, and then you can pull this out. So again, line up the lines, follow the directions, spin it, it's locked. Okay. You can give meds through this. There's two ports. One's labeled feeding. It's going to be hard to see. Feeding, and the other one's not labeled, but that's your med port. Okay. So the smaller one's the med port. The big one's the feed port. They do feed into the same tube. This is not a dual lumened tube. It's just, this is bigger for the adapters and that's smaller. Okay. The easiest Mick button insertion you've ever done. The other thing that happened a couple of years ago now is the hospital went to what's called ENFit fittings, and you've probably seen them on our 12cc med syringes. Kind of looks like a reverse Luer lock. Okay. They're generally purple in color, with the exception of this, although the cap is purple for this, but okay. This can make things a bit tricky because Mickey buttons generally do not have that end, okay? They're just a straight feed. Our feed settings do come with ENFit. So if you're gonna feed, or even if you just want, you're gonna be giving a lot of meds to via Mick button, you don't want this adapter, Okay, and we do generally carry some of these. Okay, and it's made by Kangaroo, and it's an Enfit Transition connector. You get it from the storeroom, you can get it from Barbara Bush. Okay, and what this allows you to do is put your syringes on. This is also the same if parents are hooking up feedings or they hook up feedings here. You'll notice they might need this piece because their feeding setup is going to have this adapter on it. So this would go in to your feeding port, or it goes in either port. Okay. Screw in. Give your meds. Always flush with a few cc's of water. It doesn't have to be special water, it just be tap water. After you give a med, flush so the button doesn't get occluded. Okay. That's how you give meds. You will have to undo this if you're not going to keep anything running through it. Because that brings me to my next point. If you have a kid that comes in and their belly is like, you know, they look 9 months pregnant, and they have a button, the first thing you should think about doing, particularly if they're having respiratory distress, air can cause their tummy to get big, their tummy pushes up on their lungs, is decompress their belly. You can't just open the cap on the Mickey button. That won't do anything. There's another piece in there. So to decompress, you'll need to get an adapter, okay? Put it on. Then my favorite trick for this is to take a 20 cc syringe. I generally manually decompress it first, okay? Again, this is sort of the pain part. You'll need the adapter. Okay. And you can decompress their tummy manually. Another little trick, pick you trick here, okay, is if you want to decompress them to gravity, leave them accessed. Forgot to mention the clamp. Always make sure the clamp is undone. Roll up a little gauze, gently tuck it in there, and then you can lay that on the bed, and that's a vent. So it will vent out and drain, and you can decompress their tummy that way. Okay? So again, this is like the decompression setup here. The adapter to the mic, make sure your clamp is open, and you can just put that on the bed. The gauze will keep it from running out. You can wrap it in chucks too, but you just want to have a little bit of vent there. Just put that next to them, and it will decompress their belly. Okay? I urge everybody, we have this all in the UB office. If you're not comfortable, grab one of us and just kind of play with it. It's a very hands-on thing. But again, the pieces you'll need are here. Okay?